Welcome to Social Security on KNTV. Thank you for joining us for our broadcast. We plan to provide some information about Social Security's programs during our show. Since this is a live show, we look forward to your questions, so please call at 312-738-1060. I'm Andrew Slaughter, Public Affairs Specialist for the Social Security Administration, and I have the job of being able to talk to you before you visit our offices to give you some information on what you'll need to know about Social Security and be better prepared to file that application online when the time comes. Today's guest is Paul Conchaldi. So, Paul, tell us a little bit about yourself.
Well, thank you, Andy. It's great to be here. My name is Paul Conchaldi. I'm a claims representative at the Chicago Near Southwest office. That's the office on Adams and Racine. I've been there for almost over 20 years now, and work a lot with the people in the hospital, in the medical district of, Strozier Hospital, Rush, the VA, and the various hospitals over there. So it's a great job, and I like doing it.
Yeah, your job is to, if they can't get to the office, you'll get to them to take that application.
We sure do try.
All right. Well, before we start our program, let's talk a little bit about some misconceptions. It is healthy to be skeptical in a world of uncertainties. Major news networks sometimes broadcast conflicting facts that require a bit of research to verify. There's even a day in October dedicated to skeptics. So this is a perfect time to tell all skeptics that there's no reason to think Social Security won't be there for you well into the future. Recently, the Social Security Board of Trustees released its 76th annual report to Congress presenting the financial status of Social Security's trust funds for the short term and over the next 75 years. We're pleased that legislation signed into law by President Obama last November averted a near short-term shortfall in disability insurance trust fund that was detailed in the previous report. With that small temporary relocation of Social Security's contribution rate, the DI fund will now be able to pay full benefits until 2023, and the retirement fund will be adequate into 2035. It is important that members of Congress act well before 2023 in order to strengthen the finances of the program. As a whole, Social Security is fully funded until 2034, and after that it is about 3/4 financed. So Social Security will still be there even for our young workers if nothing changes. But many people wonder, will there be the money for them? And here's a fact that will relieve any skepticism you might have. The increased cost of providing Social Security benefits to baby boomers is less than the nation's increase in spending was for public education when baby boomers were children. Put your skepticism aside and rest assured that Social Security is with you today and will be with you tomorrow. You can read the entire report at www.socialsecurity.gov/OACT/TR/2016. Okay, so now that we had our little news broadcast, I just wanted to talk a little bit about Social Security because it's not just a retirement program. As those earlier slides showed, Social Security benefits are there for spouses, for children, divorced spouses can also receive benefits, as well as survivors. So we can talk a little bit about that. But when we think about disability, we always hear Social Security disability, SSI disability. Are there two different programs?
Yes, there are, Andy. There's two entirely different programs. One program is Social Security Disability, or what's called SSDI. That's the FICA on your pay stubs. That's part of the Social Security money that's taken out of your paycheck. It's based on how much you've paid into the system. It's based on, then again, how old you are, how long you've been paying into the system, and calculates a benefit based on your years of work and how much you've worked. Think of it like an insurance policy. The more you pay into the insurance policy, the more you get back in benefits. The other program is called SSI, Supplemental Security Income. Now, it's important because it does not come out of the Social Security funds. It's part of the general revenue. But it's a program for people who never worked or haven't worked lately. It's also a program that works for children and children with disabilities, and in fact, babies can get SSI. SSI is need-based. So think of it like public aid. Public aid benefits are based on the income, the resources, the living arrangements of the people that are disabled, as does Social Security. So a lot of it's the same thing. In other words, the disability part really kind of is all the same thing. The only difference, outside of that, though, there's totally different sets of rules.
All right, and I know one of the ways to apply for Social Security disability is by doing it on our website at socialsecurity.gov. You can apply for disability. There's a quick link. Also, if you go into the menus bar, you can get more information about disability. Some of the information that we'd like to know about disability really is well, how long does it take for a decision? And then what do we need, or what will a person need?
A lot of that depends upon what the disability is and how long you've had the disability and when the disability actually began. For a lot of there's a lot of illnesses that are very difficult for us to draw a line. In other words, when did your diabetes become so bad you couldn't work? Okay, so you had diabetes before and you have diabetes now. What's changed? How does it make it different? Mental illness is, again, the same kind of thing. We have to put a date sometime, in other words, the date you became disabled, the date the person became so disabled that they could not work. We usually use the date you stopped working, the date you last went into the office, the date you last went to the job, the date you last worked as the date you became disabled. Sometimes also, though, it may be real easy to determine the date of what we call the date of onset, the date you became disabled, the date of the car accident, the date of the stroke, the date of the gunshot wound. Those kinds of things, again, are real easy to determine the date you became disabled. Then we look at two other things. Are you disabled now? Sure. Will you be disabled a year from now? So we have to show not only are you disabled today, but October 2017, you will also still be disabled. This is why, for example, someone with a broken leg may not qualify. Are they disabled today? Sure. But the broken leg will heal, you put a cast on, you walk on crutches for a little while, you get a little therapy afterwards, and you're good to go. This person would not be, under our rules, for example, disabled. And then the third part of the criteria is at what point in the past did you become disabled? And again, that would be when we would go back to the date you last worked and say that's the date you became disabled.
And that's pretty important. I mean, especially just to remind our viewers that Social Security disability is not a short-term program. We don't have like a sick where if you're temporarily hurt, hopefully there's workers' compensation or disability benefits that you may have for that. Social Security is more of that long-term. Remember, folks, you can always give us a call if you have any questions at 312-738-1060. But as we think about disability and we think about what we need for disability, let's think about some of the information, because you covered when it started, what is, but we really need that medical evidence. So keeping track of the doctors and hospitals you've gone to may be a little bit difficult because you may not think of your condition as a disability at the early onset of it, and then once you get further, you may have to remember. So not everyone may have a journal or ledger, but as long as you can keep an idea of approximately when you started seeing the doctor, or your first hospitalization, when those tests were done.
What's important for us, Andy, is not that you have to get the records yourselves. This costs money. A lot of hospitals, doctors' offices will charge you a fee. You don't have to go and get them. Don't do that. But what we need is dates, names, and places. Where were you? When did it happen? What hospital did you go to? What doctor did you see? You can't just say, oh, well, that doctor over there on Wood and Canal. Well, that doesn't help the guy in Springfield who's never been to Chicago. Okay? If we could get the guy's address, his phone number, in other words, how do we get to the medical sources that document that you're disabled?
Yeah, because I mean, our disability process takes a while to gather that evidence, make a decision. We take each case independently, so each one is a unique case, and we look at them all differently. So it can take 3 to 5 months for a decision. A lot of people say, well, what can help speed the process up? Best way is getting us the complete dates, addresses, and names so we can get your records quicker.
Yeah, the other part is a lot of times you also kind of need to think about it in the sense that you don't want to be that sick. Okay? If you have stage 4 cancer, yeah, we can get that approved pretty quickly. You don't want to have stage 4 cancer. You don't want to be that sick. Okay? So part of it taking a long time for us is determining, will you be disabled a year from now? And if you ask your doctor, is this going to be permanent? Is this going to last forever? Your doctor may not even know, depending upon what your condition is. Maybe the new medication will work. Maybe the new therapy will work. Maybe you'll be able to go back to work. And again, a lot of times I talk to the physicians and they'll say, well, we don't know. Well, we don't know means no, unfortunately. And that's the part that's very frustrating for so many of our clients.
So hopefully, if you have any questions about disability, please pick up the phone and give us a call. We can talk a little bit about it. Otherwise, if you really are looking into filing an application, you can contact us directly. I mentioned earlier you can file for Social Security benefits online at socialsecurity.gov, but you can also call our 800 number at 1-800-772-1213 to schedule an appointment. We can still start the process online because when you have those records at home, that's the easiest way to get them put into the system. But you can always contact us. The sooner you do that, the sooner we can start the ball rolling.
Also, the important part of filing online, or at least starting the process online, is you get to put it in the way you want it to be. You don't have to wait for us. You don't have to do anything different. You don't have to have anybody represent you. Okay? You need to put the stuff in yourself. If the medical evidence that you have documents that you're not able to hold down a job now and that you won't be able to hold that job a year from now and do the same kinds of work you were doing, you don't need anybody to represent you. You don't need anybody else to help you. Okay? Be sure that you take care of your own stuff. This way you get to do it the way you want it done. And that's a way to help. The other thing that's most important is be sure you put all of your illnesses. Don't just say, well, I'm going to apply because my leg hurts. But if your leg hurts and you're also taking diabetes medication and you're also taking heart medication and you've also got high blood pressure, put it all in there. Okay? Put it all in there. It doesn't matter what you apply for. It doesn't matter what the disability is. The amount is still the same. So throw it all up there and see what sticks.
All right, well, we'll see what we can because we do have a caller on the line. So let's take a call. Let's take our first call and see what we can provide assistance-wise. Caller?
Hello.
Hello.
I was wondering, once you apply, are you assigned a caseworker of sorts, someone who you always call if you have questions, or an office that is assigned to you in your case?
Usually the office will be assigned by your zip code, but you can go to any office you want to go to. It doesn't matter really who you see at Social Security. We pride ourselves that everybody's well trained and everybody kind of does the same thing. I would, however, kind of stick at the same office. In other words, if you're bringing stuff in to add to your case, bring it to that same office that you started at. You don't have to, of course, because we put everything on the computer now and it all kind of meshes together down in Springfield. Again, what happens is after you file your claim, we send it to Springfield. So you'll have an adjudicator in Springfield that's making a decision on your case. He may never have ever been to Chicago before. So again, that person will be a totally different person that will be making the medical determination about whether or not you're disabled.
So when you apply for Social Security benefits, Your caseworker is all 60,000 Social Security employees. We pride ourselves on being able to access your information electronically. So whether you're calling our 800 number or you're visiting a Social Security office, we'll be able to pull your electronic file and be able to answer your questions. So we want to make it as convenient and as easy as process as possible. So yes, you will have one medical examiner take care of your decision-making process, but when you deal with Social Security, anyone at Social Security in the field office or at our 800 number will be able to help you. And, so keep that in mind. There is no set caseworkers, but everyone at Social Security will be your caseworker.
The other part that's important about that too is also, let's say you get denied, you have appeal rights. And so if you do get denied, you have 60 days to appeal that and say, you guys are wrong, do it again. Okay? And again, what happens is you go into the Social Security office, you file it again, and when they send it to Springfield, they'll give you a whole different set of adjudicators. So it's not going to be the same guy looking at the same thing over and over again. It'll be a different guy because maybe he missed something that the first guy caught, the next guy caught. Maybe there's a piece that's missing that he can request it from you, a piece of information, a test result, a lab result kind of thing. A lot of times that's how, and then you might get approved at the second, what we call the reconsideration level. So that would help a lot also.
So, keeping with the theme, since, it's Disability Awareness Month as well, so October has a lot of awareness months going, but one of it is disability awareness, so we really want to kind of get an idea about the disability process. One of the biggest problems I remember when I used to be in a field office and take applications is kind of the tough spot you may be in, because to receive Social Security disability benefits, even though your condition may be severe enough to qualify, if you're still working, we can't pay you because one of the parts of our definition is you have to have a medical condition that will keep you from working at a substantial rate or substantial gainful activity. So what is substantial gainful activity? What do we kind of look at that?
Basically, we look at a couple things. We look at what kind of job are you doing, and will you be able to do that kind of job in the future? Even though, for example, let's say it's part-time, we look at how much money you're making, okay? So we use a definition of about, let's say, $1,100 a month. $1,130 before taxes, and again, that's the gross amount. So in other words, if you get paid every 2 weeks, that's both paychecks added together. And not how much you take home, how much you made before they take out taxes and things like that. So if you're over that amount, you're not disabled by our definition. And what we mean by that is you're not so disabled that you can't work. The other part to think about with it is, for a whole host of people, your Social Security benefit's going to be less than that anyway. So you're like cutting your benefits in half. If you're cutting your income in half. So if your benefit comes out to be more than you're making on the job, then yes, maybe you should apply for benefits. But if you're making more money at your job than you would get on Social Security, you're better off where you are. You're making more money where you are. You have more money to pay your bills. You have more money to take care of your business. Now, the important part is also, though, with Social with Social Security disability, there's also a 5-month waiting period. So if we say you became disabled today, your first check is March. So how you going to pay the rent, how you going to pay for food, and all that stuff between now and March. So it is always important for you to have some savings, to have some money stashed away to take care of yourself, during that time. It's also, though, if you're in true economic need, that's why we do the SSI application at the same time, because remember we talked about SSI being need-based. But your Social Security benefits may not kick in for quite a while, so that's why it's very important to have some stashed away.
All right, before we talk a little bit more about SSI and how it could be there to help, because when we think about disability, we can plan for retirement. We cannot plan for disability. We don't know that date if that were to happen.
We don't know that date, but we can plan for the eventuality.
But just in case we do have SSI, and we'll keep that thought lingering for a little bit because we do have a caller. So let's take our next caller.
My question is, will there be a cost of living increase next year?
Since we're getting close to the end of the year, the most popular question I get when I'm out at senior events or even out doing any kind of public outreach is, what's our cost of living increase, or are we going to get one? Social Security has that law built in where we look at the consumer price index and we compare that basket of goods from one year to the other, and we look at actually the third quarter. So we just wrapped up the third quarter of this year, July through September. So now the Department of Labor Statistics is taking a look at that and will come up with what we need for a cost of living. So we'll probably know toward the end of this month. So just hang in there. You'll hear from us, or keep watching us every week, and as soon as we find out, we'll let you know. But it's not set yet. So as we wrap up the show, let's go back to SSI and talk a little bit about those resources.
Well, with SSI, remember we were talking about that, but the income, the resources, and your living arrangements. All of that stuff makes a difference in whether or not you're disabled or not. With SSI, there's a resource limit. So in other words, you cannot have more than $2,000 in resources in order to be eligible for Social Security. Again, think about it. If you had $10,000 in the bank, we would say you're probably not eligible for a need-based program. Okay? A need-based program means that you're in economic need. Okay? So we would expect you to pay that down or do something with it before you applied for Social Security. Unfortunately, that also comes to things like, your 401k, your thrift savings plan, your benefit package, any benefits you would get from your job, workman's compensation, unemployment, all those kinds of things, veterans benefits. All that stuff would make a difference in terms of your SSI benefit. It does not, of course, though, count for your SSDI benefit. Remember, the SSDI is based on how much you've worked and paid into the system. So, again, that's the insurance policy one. That you worked, you paid, you get.
All right, well, thank you. I hope we got to give you a little bit more information about our disability programs. And as we wrap up our show, as I talked about, October is a busy month, and part of October is Social Security is committed to treating all Americans fairly, and this commitment extends to lesbian, gay, bisexual, and transgender people covered by Social Security's many programs. October is also National Lesbian, Gay, Bisexual, and Transgender History Month. It is a month-long annual observance of the history of the gay rights movement, first observed in 1994 to coincide with National Coming Out Day. The month has evolved to include a more diverse range of people identified as LGBT. On June 26, 2015, the U.S. Supreme Court issued a decision in the Obergefell versus Hodges, holding that same-sex couples have a constitutional right to marry in all states and have their marriages recognized in all states. This decision made it possible for more same-sex couples and their families to benefit from Social Security. We now recognize same-sex couples' marriages in all states, and some non-marital legal relationships for purposes of determining entitlement to Social Security benefits, Medicare entitlement, and eligibility and payment amount for Supplemental Security Income, or SSI. We also recognize same-sex marriages and some non-marital legal relationships established in foreign jurisdictions for purposes of determining entitlement to Social Security benefits, Medicare, and SSI. We encourage anyone who's unsure whether they are entitled to or eligible for Social Security to apply right away for benefits. Applying now will protect against the loss of any potential benefits. If you have any questions about how to apply for benefits, call toll-free at 1-800-772-1213. And again, you can always visit Social Security's website at socialsecurity.gov and click on the menu for people like me. And from there, that list will show same-sex marriages. It'll also give you information about other situations that may apply. So with that, remember, Social Security is a resource for you in all things. And we'd like to thank you for visiting with us, spending some time and taking some of our calls. And hopefully, as you have a chance, you'll see us again every Wednesday through the end of December. Thank you and have a good evening. Thank you, Paul.
Thank you. It's great being here.